Well, thanks for joining me for this webinar. Today I'm at home and I'm sharing on the subject of micronutrients, health and pain. This is a very important subject that is given very little focus within the medical curriculum in our learning. And as I've gone through the last 30 years within the medical field, I've done a lot of reading on this subject and incorporated a lot of these practices as a family physician, and identified great resources along the way that's helped me with this. So, let's start first by outlining how I see the food pyramid. And it's just my own take on the food pyramid. There's many Health Canada food pyramids, etc. And they change over time as new evidence comes to light and proofs of certain foods causing problems within our health. So if you think of a pyramid, at the top of the pyramid, I would put micronutrients, minerals, vitamins. Next, the healthiest food for pain would be an anti-inflammatory diet, which is avoiding lectins, which I've talked about in a previous PIPN webinar. And then underneath there, you get into the world of vegan and vegetarian, and then meat and dairy, and then underneath processed foods at the bottom. So that's just how I describe the food pyramid to patients, and talk often about an anti-inflammatory diet, but not too often about the micronutrients. And so that's why we're doing this webinar today. So what are they? Well, they are essential minerals and nutrients. They're essential because the cells in your body, and we have, remember, 30 trillion cells in our body, depend upon these minerals and nutrients for their function. They're absolutely essential, hence the name. And there's lots of them, absolutely tons of these things. Now, what are they not? Well, they're not your food groups. They're not carbs, although they're in carbohydrates. They're not proteins, although they're in the foods that we eat that are proteins, like meats and tofu and other meats. Corn, that's corn, Q-U-O-R-N. They're not fats, although many of them are fat soluble. There's vitamins that are fat soluble. And the flip of that is water soluble. So the water soluble are B and C and K. The fat soluble would be, don't quote me, I think A and D definitely. So some are water soluble, some are fat soluble. And then you've got the, I'd say water is, in my opinion, another macronutrient. We need water to be healthy because we are 70% saline solution or saltwater solution. So water is an absolute essential food group. So that you could call them the macronutrients, but the micronutrients is what we're talking about today. These smaller, very small amounts in our body. You got potassium and sodium are the biggest two that in medicine we would measure if you go for a blood test. So you're not feeling well, sodium, potassium be the top two. Other common ones relating to pain would be magnesium, vitamin B12, we would measure that, as you're well aware. So these are some of the minerals and vitamins that the medics do check, and in a general panel for being unwell, with a variety of different medical causes. So, but we're going to dive down into how can this subject be helpful for you on your journey. Well, first of all, we need to go back in time and look at the history of foodstuffs causing disease, or lack of certain nutrients within foodstuffs causing disease. If you go way, way, way back before medicine was here, That's pre the Greeks, 2,500 years ago, when humans were hunter-gatherers. They were, they had their campfires, they roasted their meats and they ate that, or vegetables and they ate that. And it was the ash from the campfire that was later used in farming on the fields that would give the nutrients. So the ash is literally full of nutrients that is good for our health. So back in the day, post hunter-gatherers, when there was farming, this was used in the fields. So you go back several hundred years ago, there's a great statement about the Brits, and I can say this because I'm British, but blimey, it's the limeys. And when I was at medical school, I had a colleague, Brett was his name, and he came from the Caribbean. So I remember him making that statement. But then, back in the day when the Brits moved across the Atlantic Ocean to the Caribbean and other countries, and they got scurvy, and that was cured by limes. And that was the discovery of a nutrient or vitamin deficiency, vitamin C deficiency, that was easily fixed with limes. And back at the beginning of last century, there was a condition called pellagra. So pellagra was a deficiency of niacin, which is one of those B-soluble vitamins. And niacin is a precursor for tryptophan. So tryptophan is in turkey, and it's the precursor for melatonin, which is produced in the brain and the pineal gland, which helps your sleep. So that condition was identified, and if you did have a condition of niacin deficiency, then you could have the 3-4 Ds. You could get dementia or other mental health issues, depression, you had dermatitis, and diarrhea, and death if it was severe enough. So hope those problems are gone. In World War II, the foods were fortified with niacin to prevent this condition. And now, in this day and age, many breads and cereals are fortified with niacin and other vitamins. Another one, beriberi. It's been known across the world, especially in Asia, for hundreds of years. But in the last 100 to 200 years, the discoveries around the condition of Wernicke's encephalopathy, which is a big fancy word for a disease of the brain associated with people who are alcoholics and are deficient in another B vitamin, which is thiamine. So medically, if a patient's in hospital with this condition, they get vitamin, the thiamine at 100 milligrams 3 times a day, and that helps the brain with confusion and other issues with that condition. So that's thiamine deficiency. Neural tube defects. All you ladies who've had babies likely took folic acid. It's in most prenatal vitamins. A dose of 400 microunits a day can prevent neural tube defects in unborn fetuses. And the last one, B12. It was interesting when I was doing some research on this. Pernicious anemia is a condition of B12 deficiency. And this was identified towards the latter half of last century. And if you are very deficient in B12, you can actually get a very severe condition called subacute combined degeneration of the spinal cord, which just means your spinal cord doesn't work properly. And as a result, you can get neuropathy, you can get chronic pain. So enough B12 in your system is essential. And as far as I'm aware, you can't take enough, or there's not a top dose of B12. And that's the whole ethos of the Burnstein diet available in North America, is based on B12 injections. And you get very, very high levels. And as far as I'm aware, you do not get toxicity from them. So that's a little bit of history, just to get the point across that minerals and vitamins are essential, and we need to look at this. Now, if you're thinking, well, I really need a proper assessment, I would tend to agree. But that's maybe not practical for everybody. But if you do want a formal assessment, a naturopathic physician would be the person to do the most in detailed assessment. Your regular family doctor could do a mini assessment, checking B12 levels and the other minerals and vitamins, as I talked about earlier, as a normal part of what we do for looking at symptoms about general diseases. But if you specifically want this, that, the next thing, then you need to go to naturopath. The other approach would be to contact a holistic nutritionist, and that's what I've done myself in the last 6 months, and dived into this subject a little bit more than just my common knowledge over the years. And it was a very helpful exercise. At the end of the day, you and I are left with a choice of what we're going to buy. So, I pulled out some of my vitamins, and I've got a few bottles here. I won't put the label, I won't tell you which company it is, but we'll talk about that in a minute. But, lots of bottles with lots of different minerals and vitamins in there to optimize the cellular function of our cells. Now, I did some research on the stats around this industry, and it's 478 million is being spent on the minerals and vitamin industry in the US this year. And that's taken a dive because of the last 2 months or so. And it was higher in the 500 million range last year, and it's estimated at a growth of about 4.8% to go up to over 600 million a year in just 5 years' time. Huge, huge industry. And when you break it down to per capita, that's a number of, how much we're spending per person. That's about $12 US average. That's across the population. So if you look at different countries, China is the highest spender on this subject. And then there's the US, Japan, Brazil, and Canada is number 3. So, sorry, number 5. So, huge expenses are going on. And, I did reflect on this many years ago. And I was reading a book by a formidable biochemist. And one of the conclusions was, well, at the end of the day, vitamins are just about expensive urine. So you take all these supplements, you get discoloration of your urine, usually by the B vitamins, and that's the yellow color, and you're just peeing it out. And I think that's a very, I have some entertainment behind me. So, and I think that just comes from an ignorance of the reality of these B vitamins and the inability to maybe test the levels, which as medics, we cannot check that many of them. And then having a response to it. Well, what do we do with the levels anyway? And the biggest challenge is there's such a small level of these vitamins in the body, in the blood, because some of them are more in the cells than in the blood, and we only check the blood level. So it is a challenge. The other thing with research around this subject, it is very limited. And the reason is our body's so complex. As I said, there's 30 trillion cells, and every single cell has enzymes and these minerals and nutrients are needed for the cellular function. So how do you tear that apart? How can you literally separate what we do as a control versus a active group of testing a vitamin? And I don't think it's possible because of the complexity of our bodies. So some reason why it's a bit of a struggle to know what's the best research on this subject or this vitamin. Anyway, it comes down to the products themselves. My tip, I've personally went for the company USANA because it's one of the top companies in the world for quality, and they've done lots and lots of research over many decades to optimize what you're buying is what you get. My encouragement would be to do a search on top brands and look at the research behind that, or check out with your pharmacist. Very important because they're very knowledgeable on this subject as well. So let's dive deep now into some tips. Now, as I said before, if you want a detailed, specified advice for you, you need to see a professional to give you this. So this whole point is just to bring you back to some vitamins and minerals that you could start using that is going to help your pain, and I believe is essential for your health. So the first one that stands out would be vitamin D. So I suggest anything from 5,000 to 10,000 units a day. Now that's a lot. That's a lot, especially if they come in 1,000 tablets. You know, I was in contact with a friend over the weekend from the UK, and they were saying that I actually saw a bottle of 4,000 units in one capsule. I was most impressed. I take drop form myself because you do 10 drops in a day if you're just using the drop form, or because of all my supplements just here on the table, you know, I use a combination of tablets and a multivitamin. You'll get some, and then vitamin D tablets. I get some 1,000 units there, but also I top it up with the drops. So about 10,000 a day is what I prefer. Interesting subject on children. You know, I've got 3 children, and I do give them vitamin D, and I give them up to 5,000 units a day, so half of my dose. It's quite a high dose, but I think it's an essential nutrient. It's almost like a hormone, and it's good for the brain, it's good for the heart, good for the nervous system, and I think it's really important. So vitamin D. A multivitamin, as I said, it's got lots of things in there, and you know, this is not the forum to go into all the details and all the function. One, because I'm not trained in it, specifically in nutrition, although I do have a degree in biochemistry. Back in the day at medical school, I studied this subject as well, so I have a degree in this, which gives me a little bit of authority to talk about this subject. So the B vitamins, what about those? Well, an average, you know, if you go looking for B vitamins as a separate entity, they come in approximately 50 or 100 micrograms. 50 or 100, you can B compound 50, B compound 100, you'll see on the pharmacy shelf. And one thing to be careful with B vitamins, and I learned this from a neurologist in the States, was if you're taking them, that your levels can increase to the point where you get not only the resolution of some symptoms of chronic pain, so it actually helps, but also you get the reoccurrence of the symptoms later. So your body, it has enough, and therefore, because you're taking them every day, it gets too much. And you know, B6 is definitely one of those B vitamins. And there's B1 and B2 and B3, B4, B5, B6, and they've all got different names: niacin, thiamine, riboflavin, nicotinic acid, pyridoxine is P6. But you know, we don't need to dive into the details of those names. They've all got chemical structures and all different. And then B12, the one we talked about earlier, is important. You know, if you are deficient in that, 1,000 units a day would be the sublingual dose to take. That's under the tongue. There's oral tablets you take by mouth, and that's a formulation of the salt that actually disintegrates quickly through the liver, and therefore you hardly get any of the nutrients from the B12. So if you're going to take oral, you take it sublingual, and you ask your pharmacist for those, about 1,000 units a day, or you can get injection form that your doctor can give you once a month usually to help correct that. But many people take B12 and it makes them feel good, and I don't really think there's too high a dose there. But you know, a good B vitamin, B12 vitamin within your B compound, or a really good multivitamin, will have sufficient B12s in there. So that's your Bs. Vitamin C. What about vitamin C? Well, I personally take about 1,200 units or 1,200 milligrams a day. Now, I personally don't take that much fruit because of the lectin load in fruit. I do take dates and figs, and that's my main focus for fruit these days. But you know, berries are a great source of vitamin C as well. So you'd have to go and check, how much of the fruit you're taking is equivalent to vitamin C dose, and see what's the right dose for you. But vitamin C is important. Zinc is essential for immune cell function, which is part of the limbic system control center. And about 30 to 40 milligrams of zinc is a great dose. And magnesium, mentioned magnesium salt. Well, a great way of doing this, and some of my patients really enjoy it, is Epsom salt baths, soaking in some Epsom salts every night to absorb the magnesium through the skin. Great thing for chronic pain, musculoskeletal pain. But if you're taking tablets, I would say maybe about 300, 600 milligrams, around that range is good for you. And tailor it, try it for a little while, try it for a week, see if there's any difference. You can increase it from 300 to 600 use milligrams, and split over divided doses. And I've used in the past 900 milligrams for patients as well. So let's move on to omega-3 fatty acids. Now there's different fatty acids. There's 3s, there's 6s, and 9s. And the big issue with omegas is there's a disproportionate ratio of 3 to 6s. So a higher 3 and a lower 6 is healthier. And that's why many of the omegas, you'll just see omega-3 advertised. And they've got different purposes, but it's really important for brain health and heart health, or cardiovascular health. That's your whole cardiovascular system, all your arteries and veins and capillaries, as well as the heart muscle itself. And also the brain with its neural connections down to the small receptors on your skin and other areas that we feel pain. So omega-3, very important. The dose, I would be recommending about 1,000 units or 1,000 milligrams per meal. I personally take about 4,000 a day. Very important. And of my kids, I like to give them a few supplements, not much, but only one of the 3 living with me can tolerate the taste of it. So there you go. So let's move on to 2 actual products that I don't take myself, but I have been advising some patients on this. And I came across them by Dr. Teitelbaum. Dr. Teitelbaum, Jacob Teitelbaum, is an awesome doc. He is in Hawaii, and he's author of many books. One is called Pain Free 1, 2, 3, or From Fatigue to Fantastic. That's his book on fibromyalgia. And I had the privilege of interviewing him for my podcast show, and he is one of the co-authors in my book called Conquering Chronic Pain. So this is where I was introduced to this world of ALA, or alpha linoleic acid. So this is a really good product to take, and Dr. Teitelbaum prescribes about 300 milligrams twice a day. That would be the dose. Some people can get off with 600 milligrams twice a day for about a month. And this is really good for diabetic neuropathy, or pain associated with diabetes. But I think a lot of our chronic pain state is neuropathic in nature, especially when we're feeling in the periphery, in our backs and our necks and in other areas. So I think that's a really good trial. I'd try it for about a month to see if you're having any benefit. And you may be thinking, well, what foods has got ALA in it? Well, spinach has, broccoli, potatoes are foods that have got ALA in it. Next is NAC, called N-acetylcarnitine. Again, a nutrient, essential nutrient in our body. And the dose there would be 1 gram 3 times a day. And after 2 to 3 months, you probably get high enough doses. You can reduce that to 1 gram per day. And it just comes to mind here, a patient I was on the phone with recently, and he actually brought up the subject of NAC, N-acetylcarnitine, and ALA himself in his research. And we had this conversation about these products. So let's move on. I just want to touch base on a few herbs, because herbs are the most nutrient-dense foods that we can eat. And it's almost all the nutrients are squished into those little flakes that you may be putting on your food if you're cooking. And this information comes from Dr. Gundry's work and the Plant Paradox book that I've highlighted extensively online. I practice this myself. I advise it to my patients. But what are the herbs? And there's 5 herbs that I strongly advise to help inflammation, which can help chronic pain and help heal the gut and leaky gut syndrome. And one is turmeric. And next is cloves. Next is cinnamon, mint, and good old black pepper. So turmeric, you can buy capsules of this. I had a gift in the last year from a friend who bought this high quality turmeric capsules, and I took one with my food. And as you're well aware, I'm sure, turmeric is a great anti-inflammatory herb that we can take by food, and I just sprinkle it on my vegetables as I cook them on a daily basis. So cloves and cinnamon, mint, black pepper, all can be used in cooking readily. And I would mix not just those herbs, but a variety of different herbs because they're so tasty and they can add a lot of nutrients to our diet. And I think variety is the spice of life, and as long as we're changing them around, I think that's really, really important. So those are my thoughts and comments on the subject of nutrients, micronutrients. So I hope this has been helpful. I'd just like you to maybe reflect on what you are doing right now. What are you taking? Maybe take an analysis, write them down. Maybe you're taking some supplements, write down what you're taking. I've gone to my list of, dosages of things several times, and I've been using this USANA products for months now. And every time I go, I kind of learn something new, which is really interesting. So there's a lot to this subject. It's immense. You're not going to get the information you need from your regular medical doctor because we're not trained in it. But you can certainly see a nutritional or holistic nutritionist for some tips, or your naturopathic physician to do testing or have a good conversation around this subject. And I work with naturopaths in my day job, and they're great. Great people, great hearts, and able to give this type of guidance for you. So shortly, I'm just going to wrap this up, but the Q&A that will be available at the PIP and live version, which I think will be in 7 days' time. I look forward to your questions on this subject. So thanks so much, and have a great day, and happy eating. Remember, have fun when you eat your food. It's not just about nutrients, it's about enjoying it. It's about the company there, the people involved. Say grace for it because it blesses the food, and I think it's a really important thing to further optimize your nutrition. So thanks so much, and have a great day.